This is Going Under, Anesthesia Answered with Dr. Brian Schmutzler. I'm your host, Vahid Sadarzadeh, and today, this is Season 2, Brian, and we have a very special guest. Our kind of series of guests continue on this month. We want to feature, and next month we want to feature all sorts of guests that you're connected with, either medically, non-medically, and today we have a very special guest who works very closely with you here in the Michiana area, Megan Hagley, MSN, CRNA, and also business owner and founder of Pur Aesthetics here in Michiana. Welcome to the podcast.
Hi, thanks for having me, guys.
Absolutely.
Yeah, how are you?
I'm good. Am I the first woman you've had on?
Yes, you are. You have the distinction of being the first woman on the podcast.
So exciting.
We are excited to have you on. So you, let's get into your background. We want to talk about aesthetics and anesthesia today.
Okay.
We want to talk about your background as a CRNA and anesthesia, and also kind of going off and founding this aesthetics business with some partners of yours, and
keeping me looking pretty.
That is also true. We do want to talk about that too. But yes, let's start.
It's easy work.
Yeah.
It's not easy being pretty. So let's start with your background and your journey to becoming a CRNA.
Okay, so I'll take it all the way back. I started my undergrad as a mechanical engineering major.
Wow.
Fun fact.
Holy
yeah.
cow. Wow.
I interned with General Motors for 2 summers. The first summer I worked in transmission controls. The second summer I worked in diesel.
I'm learning things here.
That's awesome.
Fun facts.
Where are you from?
So I grew up in Milan, Michigan, which is just south of Ann Arbor.
Okay.
And my dad and uncle owned a collision repair shop all my life. So I grew up kind of in the car industry.
So that's initially kind of what you wanted to do there.
It is. Yeah. I was going to take over the family business. Yeah.
Okay.
So I loved the technical aspects of it, but it was a lot of desk work, which I needed, as I found out in that time period, I needed more activity. So my undergraduate degree, I then transitioned to human biology. Didn't really know what I wanted to do. Ended up getting a nursing degree from a community college in Ann Arbor. Went straight into the ICU after that. Worked in the surgical ICU for about 2.5 years. And near where I was working at in Toledo, Ohio, they were like, "Hey, we're starting up this anesthesia, the CRNA school. I really think that you should apply." So within, 3 days, I took a GRE and put my application all together and got accepted. Nice. So
that's awesome.
Did that for 2.5 years. Yeah, thanks. It was kind of like, I'm going to see what happens. If I get in, great. If not, I know that, working in the ICU is not what I wanted to do forever, just because it can be really stressful. Oh, yeah. So
because the OR is so much less stressful.
Well, at least I get to have one patient
right,
at a time.
That's true. Instead of 15 or whatever. That's true.
Yeah. So, went to anesthesia school, and then I started working at the hospital one of the hospitals I trained at for, I think I was there for maybe about 4 years. And then we moved over to the west side of Michigan, and I met Brian. Didn't work together right away, but then have since transitioned, and we've been, working collaboratively or together, whatever you want to call it, for about 4 years, 5 years, both my husband and myself, because my husband's a CRNA too, so.
Did you meet your husband in school?
Ask the exact same question. How'd you guys meet?
So I did not. I met my husband through a mutual friend I went to grade school with, and he did his undergrad with her. So it was kind of this super chance meeting. We met after a football game, the MSU U of M football game. So
before or after CRNA school? Yeah.
I was in school. I was in my second year.
And he was?
He was doing a travel contract at U of M.
Okay, nice.
Yeah.
All right.
Yep. So as a bedside nurse.
Nice.
So
how did you guys pick Michiana?
He grew up in this area.
Okay.
Yeah. So we moved back to be by family. We moved over when my oldest daughter was about 6 months old, because where we were living at the time, my parents retired down south. My sister and her husband moved down south to South Carolina. So it was challenging. Anybody who has little kids, they know if you have 2 working parents, you almost need a third spouse.
Yeah. Right.
Yeah.
you need an available parent. I do. I'm I need a wife.
Just to clean and to take care of the kids and stuff.
I know, just to coordinate. But, we've my husband and I worked really hard to get to the place where we can have a little bit more availability for our family.
Sure.
Which has been a lot of work and a labor of love. But, we're getting to that place.
I was going to ask, with 2 CRNAs in the family, how do the schedules? I mean, how do you know your schedules and like
You don't.
where
You
you're going to be and
don't.
how challenging is that?
So that's why we moved over here to have that support from his parents and sister and brother-in-law. So that is one of the biggest challenges that we have, because working here, we work in a very like independent collaborative model, whatever you want to call it, where we run our own rooms as nurse anesthetists and physicians. Like they do their rooms, we do our rooms. Like we take the patients through pre-op, operative stage, post-operative stage. And you work until the work is done, regardless of if that's
It's
early
not
or
right.
late.
It's not really shift work. Yeah.
Right. So you're done when you're done.
Right.
So you know like where you're going to be at for the next day, but what that looks like,
Sometimes you know
yeah.
where you're going to be at the next day.
It's true. Some mornings you're like, hey, I need you to go here. But so it was challenging in having that familial support. Or at one point we had a nanny for a short period of time, and it just didn't really like work for our schedule, and it wasn't really what we wanted as a family. So it does take some work.
Yeah, I guess for up and coming CRNAs, if like they meet their spouse in school or whatever, what type of advice would you give those people, having kind of both been in it now
Sure.
for a little bit?
It takes coordination, and it takes working really well together. Like, I mean, I love my husband. I think he is amazing, and he does a really great job, both as, CRNA and as a husband and dad and father and all that kind of stuff. But we work really well together and trying to figure out like who's doing what day. Now with having the office, I have a lot more flexibility with being the available parent. So, I drive a lot of the times or pick up a lot of the times. And if we have a sick kid, like sometimes I'll take him to my back room if that's an option. Like, if they're really sick, then obviously we're just going to cancel patients and reschedule them at the office.
Yeah.
But also Brian's really great at understanding, like, hey, just
Can't come
a
today,
heads
yeah.
up. Yeah, we might have some scheduling issues tomorrow
Yeah.
or whatever. But so it does take some coordination and who's going to take what position. If you have the opportunity to take a shift work from 7 to 3 and one of the parents wants to take that, the other one takes the call position, like it does take coordination and working together as a team.
Do you still have interest in mechanical engineering and vehicles and stuff like that?
I do love cars. I would say I'm less out of it than I'm more out of it than what I
Yeah.
used to be, just because I just don't have time.
Can you fix a Jeep windshield? That's
It was already
That's
fixed.
where he's going.
It was already fixed.
Oh, okay.
Safe Flight, if you want to sponsor this.
There you go. Yeah, exactly.
I was going to say that might get a little heavy.
Yeah, right.
You and Ryan can do it together.
Right.
You still love cars? Are you like, you consider yourself like a car person? Like,
Maybe I don't know. I would say I can answer less questions than what I used to be able to. But I did spend a winter break fixing my car when I was like 16 because I had
Wow.
some
what
when you're 16 and things run into your vehicle.
what did you fix? What was the car?
It was a Taurus let me see, what year was it? Maybe 2000.
Back before there were computers on wheels, right?
Yeah.
So
Oh, yeah.
they actually had mechanical parts.
So you can actually fix
Yeah,
it?
now it's just a computer. You got to take it to somebody and fix
Yeah,
the
I mean,
computer.
I'm 40, so I've been
Yeah.
driving for a while.
Oh, okay, so I have to ask you, this is an interesting question. What was your first vehicle?
Oh, have we done this?
I don't
was
think so.
Mine was a Ford Taurus.
Okay. This 2000.
What year?
No, it couldn't
2000?
have been a 2000 Taurus.
Let's see. Well,
No, yeah, it couldn't have been
No,
2000.
that's actually close. You probably started
Yeah.
driving in 98, right?
Yeah.
So
No, and then it was the 98.
Okay.
It was the 98.
98 Ford Taurus. So it was new, though.
It was.
It was new.
It was.
till she wrecked
Was it
it. Till she wrecked
was it
it.
an SHO is
Oh,
the
look at
question.
that.
And it was not. So it wasn't brand new. My dad bought it at an auction because
Okay.
my uncle has a towing company, so he had his dealer's license, so he
Nice.
was able to go there. Yeah. So
Brian, what was your first vehicle?
92 four-door Honda Civic.
Oh.
I started driving before she did, though.
So you've been a Honda Toyota guy for a while.
Yeah, there was one GM car in between, and I'll never go back.
Okay. Nice.
I don't do American cars at all, really. Well, it's not true. We have a Raptor that my father-in-law drives, but aside from that, we don't do American cars.
Okay. Nice. Mine was if you're wondering, nobody cares.
I
but
do. I
We
wonder.
do. We
I want to
care.
know this.
So my parents, one of their best friends was a cardiac surgeon in Madison, Wisconsin. That's where I grew up. And he had Volvos. Like, he loved Volvos and Saabs. Like, he had the Swedish.
They run forever.
Interesting.
He like, and you know those like 80s Saabs were really, really cool.
Oh, yeah.
Well,
A
he had
Seinfeld episode about that. Yeah.
Was it a hatchback?
Weren't they
no,
all?
this was
I
a
thought they were
squared off Volvo. It was so he had a Volvo. He wanted to get rid of it, get a new Volvo. So it was a 1988. So it would have been 8 years old by that time.
Yeah.
Because it was 96. It was a 1988 Volvo X. What was it? A 760 turbo intercooler.
Ooh, nice.
But the passenger seat was broken, so it was like slanted towards the driver's seat.
That's bizarre.
So any girlfriend that was in the vehicle had
Stare
a,
right at you.
Just automatic.
but the head gasket blew in college,
And
and
didn't fix it, I assume. Yeah.
I just left it on the highway. Dad, if you're listening to this, I'm very sorry, but some of the things you learn when you're a kid, you know.
So
I mean,
the Volvo, they had the station wagon with the backward seats, didn't they? Wasn't that Volvo that had a station
don't
wagon with
know.
backward seats?
that was a Buick. We had the Buick.
Did you? Okay. All
So
right.
my mom had a green Buick station wagon
Okay.
that was so 1980s.
But the very back seats were
very
backwards.
back seat would fold up, and you could sit facing backwards in the vehicle. Oh yeah, talk
okay.
about not
All right.
safe, no
No.
seat belts.
I just remember, like, we always had like different vehicles
Yeah.
because my dad was in the industry or whatever. But the one that I remember distinctly, we had a Rabbit convertible.
Ooh.
And we lived on a dirt road, and so
Yeah.
my dad would go down the dirt road with us in it, doing donuts.
Oh, jeez.
I'm sure to my mom's horror.
Covered
But
in
yeah.
dust.
Yeah.
Oh,
It was so fun.
I love vehicles.
Do you?
Yeah, talking about vehicles is fun. It's a cool background, you know.
Yeah.
I like her husband's truck. I'm very jealous of her husband's truck.
Raptor?
No, he's got a brand new Toyota Tundra.
Oh.
I know, yeah.
I just saw one of those the other day. We were talking about the Sequoia.
Yeah.
And Heather was wondering how it drives, and I'm like, probably like Brian's truck.
Like a truck.
Probably
Yeah.
like Ryan's truck.
Yeah,
So
because it has
it's not a
that same
truck chassis.
chassis.
it's a chassis, yeah, but the engine's different. And
I've turned into a Jeep guy, so not like fully, but a Wrangler.
I think my husband would love one of those.
Oh my gosh!
so why
it's
doesn't he get
fun.
one?
Well, we only have 2 drivers.
So
We don't have any. I mean, I could.
If
we
you
only
guys
drive
want to
one
take,
vehicle
you
at a
guys
time.
can take it out
I
anytime.
saw it. It looks real nice. It looks real pretty.
see, she is
It has a V8 engine,
Oh,
and
goodness.
so I was
it's
like,
the Rubicon, right?
yeah, the Rubicon
Mm-hmm.
V8, because I thought it was the last year they're making them, but now they're making another year
Okay.
because
Oh,
they were
backlash, yeah.
well, they were like, oh, the last year, so everybody ran out and got one. Then they jacked the prices up,
Yeah.
and then they're
Right.
like, oh, we're gonna make another 3,000 of them.
kidding.
Sorry. So the Jeep community is up in arms.
capitalizing.
The Jeep community is a very
Tight knit.
So I just
tight-knit-
learned about the ducking thing.
Yes.
Yes.
I didn't know about that because
Yes.
we had partnered with another business in our little square for
Oh yeah, Urban Swirl, right?
Yeah,
Yeah,
yeah.
Urban Swirl.
Yeah.
JC's did that too. Yeah, yeah. Nice.
for duck your Jeep, and I was like, I have no idea what this is.
Yeah.
Wait, so were you there last Thursday or?
I wasn't. We had sponsored some of the ducks, so
Nice.
if you got one, come on in.
Yay.
What was the
Sweet.
deal?
If you
I
need
didn't
more
get
ducks,
one.
we have more ducks, by the way.
Oh, perfect. Yeah, let's
What,
do it.
what was the deal?
I think it was $50 off your first treatment.
Oh well, too late for me.
$50 off your 100th treatment. Is that?
yeah, probably.
All right, let's
All right.
transition
Yeah,
to that,
let's
by
hear
the
it.
way.
Yeah, let's
All
hear
right.
the story because I don't know the story either. How you got in went from. I mean, I now I know the story of nurse to CRNA. How do you
Yeah.
go from CRNA to aesthetics, doing all that stuff, owning your own business?
Sure. So it kind of ties into what we were talking about with scheduling and family, and it kind of came out of that because it was hard. It was really hard. The place that we were working before I had my second daughter, both Ryan and I, there were 4 CRNAs that worked there. 3 were full time, including my husband. There were 2 other ones, and then I worked part time, which was 4 days a week, and then I took call 1 day a week. But the rest of them were on call 1 and 3. So what that means is like every 3rd day and then every 3rd weekend. So if you add up every 3rd day and then every 3rd weekend and plus my call day, some weeks we were on call 5 days a week, and it was a lot. And it got to the point where it was like, this is not working for our family. Like, it was so stressful. Like, if I was up nursing my daughter, because she was from when she was 6 months to when she was like 1.5 years. So there were a couple of times where I was up in the middle of the night nursing our daughter, and I got a call. And so Ryan would go in for me. Like, thank goodness we had that flexibility, because I was like, I'm already doing one job. I don't know.
Can't do both.
I can't do both.
I mean, you could. It'd be a little awkward in the operating room. But
it was very stressful. I have pumped in the rooms before. Thank you, Willow.
Oh, wow. Holy cow.
Wearable pumps are like, that's where it's at. So
I don't know how you do it. I can't even hardly do my job.
Yeah, you spend half the day looking for your iPad. So.
I do.
True story.
Well, thank goodness for your watch where you can just ping it. So then, COVID happened. I had my second daughter in November of 2019. I had gone back to work for 2 weeks, and then everything shut down. And where Ryan was working at the time, they would take 1 week on, 1 week off. And I just want to give a shout out to all of you stay-at-home moms, because, oh my gosh, so like that is the hardest job, like hands down, no discussion. So I applaud every single one of you, because I would not be a good stay-at-home mom.
Me neither.
Yeah, we already know that.
Jeez.
Thank goodness.
Killing me on my own podcast here. All right,
goodness.
fine, whatever.
But there are
you just get ready. When do you guys do?
Huh?
When do you do?
October.
Yeah, you get ready. Just get ready for that. Sorry, go ahead.
It's gonna be so good.
I'm already tired.
I know.
But there were times like where he'd be his week on it. I was credentialed at the same facility. I was like, can I do it? Can I go in, please?
I'll trade you.
I'll trade you. But it was to the point where like it was just so stressful trying to figure out our schedules, and with the addition of another baby, who was going to be doing what and what. So I had started back getting my doctorate, because I was actually going to get a dual degree doctorate and accounting degree, and I was like, I'll just do my own little firm.
Wait,
whatever.
so why did you decide on that quickly? Like, what was the
I love
impetus?
math.
Okay,
I've always been like a big math nerd. So I was like, I'll
So
just
wait, you were
going to
quit anesthesia and do accounting?
Not quit, but like.
Wow. Holy cow.
Kind of like, it's kind of like what I do now.
Kind of like the side thing, yeah.
Okay,
get to give more flexibility.
Gotcha. Okay,
yeah.
Got it.
And I did one class, and I was like, nope, I can't do this again. I can't go back to school. And at the time, another CRNA, Kelly Hermans, had her own med spa and was starting a training facility.
Yeah.
And at the same time, it was kind of like intertwined, where my husband had taken a picture of myself and my youngest daughter outside, and I was like, oh my gosh, like moms don't get pictures of themselves and their kids like hardly ever. And I was like, this is such a great picture, but what is happening to my face? Like, I did not understand it. I did not know what was happening, but like who I remembered being and who I saw in that picture were like completely different. They were not the same person. So I started to kind of researching, and I was like, oh, this aesthetic thing's like, kind of looks fun, and went to training, got my own treatments. And I remember sitting up for my treatment at training, and I was like, oh my gosh, like this is my face. I got a set of cheeks. So I got 1 syringe of filler split over both of my cheeks. So a half of a blueberry over both my cheeks, which is nothing. Now I have like, 10, 12 syringes of filler in my face. But I sat up and I was like instant tears, because this was my face 5 years ago. Like I pulled up pictures from our engagement photos. And I was like, this is me. Like, look, everybody, this is me. So from that instant, I was hooked, because I never really thought of myself as like someone for aesthetic treatments or Botox or fillers or all the things that we do, right? But I was like, oh my gosh, there's something for everyone here. Yeah. So it just kind of like transitioned. And like I said, I've always been kind of like a math nerd or like a business-minded person, especially from like my dad being in that, aspect of life. So it just kind of like took off that way. So this was like 2020 that I did my first training, got all the business timing. I know, right in the
Started
middle
business
of COVID.
in COVID.
But it's just been very transformational, not only from a personal perspective, but also just from helping other women and men just kind of
we'll get to that.
Feel better about themselves. It's truly like at my office, we really build relationships with people. It's not like a one-stop shop where, you're in and out and like see you later. We really do work long-term. We're like a marathon type office. Like we work long-term with our patients. We build relationships with them. Like it's so fun, like seeing them transition through phases of life. So it's really cool. Like, so that's kind of how I got started on that. It's really born out of 2 things. One is having more availability for my family. And 2 is because of how impacted I was by my own treatments.
So 2 questions. One, the first part is, as a CRNA, do you think as a pathway, because we've talked about this before, do you think this is viable for anesthesiologists or CRNAs
Sure.
or AAs, like if they have interests kind of coinciding with what you're doing already, like, is this a good model?
Sure. So I can't speak to AAs because I don't know how they function outside of the perioperative area, just because of licensure and whatnot. But I function as a RN in Indiana because I do not have prescriptive authority outside the perioperative area. So we have nurse practitioners in our office that see all of our patients beforehand, and then of course we have our medical director. But absolutely, I mean, I think anybody can be a great injector, whether it's a nurse or a CRNA, NP, physician. Really, from my perspective, having that in-depth knowledge of procedures, anatomy, pharmacology, I think it kind of gave me a little bit of a heads up in terms of like just the technicality of the procedures. But I think there is a science and there's an art. Same with anesthesia. There's a science and there's an art behind it. If people are trained appropriately, they can get someone through an anesthetic safely, whether it, looks good and is the best for the patient. That there's good and bad of everything, right? It doesn't matter what your credentials are.
Yeah, I mean, I could probably do the injections, but I would suck because I don't have any of the like planning, and I wouldn't know what I was doing, like to make it look good, right? If you told me to put a needle here and inject appropriately, I could, but it's not. I mean, obviously, she does a lot more than that. So
the second part to that question is, what is the relationship between medicine and, maybe more of a general medical question for you both, but the relationship between medicine and aesthetics, like. That has grown over the years,
Sure.
as we've seen. I mean, it's become very popular over the last couple of years. Where is that relationship between those two, and has it always been like that?
Yeah, she'll have to speak to that. I know nothing about aesthetics. So.
Well, you can speak from the anesthesia side of it too, but
Yeah, I mean, I guess from the anesthesia side, I think we do more and more cosmetic procedures, anesthetics for cosmetic procedures. So I would agree that it's growing as a specialty, as a practice. But in terms of the aesthetic stuff, you'll have to answer that question.
So in our practice, it's very highly integrated because all of our injectors are advanced practice providers. So there's myself, who's a CRNA. I have another CRNA, Jamie, and I have two NPs, Melissa and Emily. So we practice at a very high level, and we train a lot. I mean, we spend a lot of money on training so that we can make sure that we are going to be the best, as good as we can be, which is very high. We practice at a very high level, like I said, but also because there is a deeper understanding. So, like Brian said, you can go to anybody and be injected, but if you're really understanding the pharmacology behind it, the pharmacodynamics, the changes in your skin that happen over time, the aging process, where pigment's coming from, like what level, what cells, you're really going to understand and have a deeper, be able to explain better to your patients why you're recommending certain treatments over others. So when you come to our office, you're not going to be getting, you're going to be getting a different level of service than if you go to someone else who is just kind of doing it on the side. Yes, I did start as that, but because of my background, I always had a really high level of understanding all of those dynamics and anatomy and how all the medications work and all the things that we're doing. So I think it really does tie in. The other thing is in our office, we do have an ultrasound and we are ultrasound trained, which I think ties in really well to our anesthesia practice, because when I'm doing anesthesia, I'm doing blocks all the time because I work mostly at an ortho hospital. So being able to transition that skill into then aesthetics, where I'm looking at muscle movement, I'm looking at filler, at vessels, what fascial planes I want to be at, it's all transfers really well, in my opinion.
Sure. Brian, we know kind of how you stand. Maybe you want to repeat it, just how you stand on working with CRNAs and AAs and just kind of how that shifted over the years, right? From anesthesiologists to CRNAs in the workforce. Maybe just reiterate kind of like what your thoughts are, and then we'll kind of get to Megan's thoughts.
Yeah, sure. I mean, so I've said over and over again, there's not enough anesthesia providers in the entire country to do the work that needs to get done. So, I mean, I have a very high level of trust in CRNAs, especially CRNAs that work with us. So, we work side by side for the most part. I've never worked with AAs, so I can't make any comments on that, just like I've said before. But yeah, I mean, so CRNAs and anesthesiologists in the operating room do essentially the same thing. And so we work well together, pretty much the same, I know it's a buzzword, but same scope of practice. We do basically the same things in the operating room. Is that where you're getting at?
Yeah.
Okay.
And Megan, kind of how do you feel as medicine is transitioning and, your practice is transitioning, kind of your field of medicine is transitioning to more CRNAs?
Sure.
How do you feel being kind of the center point of that transition in that field?
That's a good question. Yeah.
Sure. So like I said about injecting, anybody can be a good injector if they have a passion and the knowledge and, are responsible for their own growth. And I feel that way about anesthesia as well. Like I said, I don't have any experience with AAs, so I can't really speak to that. But in terms of physicians or, CRNAs, I have personally worked with physicians who are fantastic, and I've worked with physicians who have not been. Same with CRNAs. So I think it really it's very individual, and I think it doesn't necessarily make a difference on your background or the letters after your name. I think my husband is great. He just finished a pain fellowship. So, he's pain fellowship certified and board certified and all the other stuff. I don't know. He'd have to come talk about that, but
we should have him on.
It's not a bad idea. Thank you.
I think it doesn't, I don't think it matters the letters after your last name. I think it depends on you as a person and how invested you are in your own personal growth and taking care of patients.
Yeah, and there's some innate ability to it as well. I mean, I knew a couple, when I was in residency, I knew a couple of people who had to drop out, not because they didn't train hard, not because they didn't, study hard and all that kind of stuff. They just didn't have the technical skills to physically be able to do it. That's a pretty small percentage.
Talk a little bit about that.
Yeah.
What does it take? The technical skills. What are you looking for?
So doing procedures does take the ability to connect your mind and brain, or your brain and your hands, right? Like you have to be able to make that connection. There's some people just can't do that. And then one of the people that I went to residency with that ended up leaving, just couldn't think fast enough, right? So if something happened in the operating room, he was just a slower processing guy. So he did fine. He went into psychiatry, did fine, right? You got all the time in the world to just
way different,
right?
Yeah.
No, but I mean, it worked for him, right?
Right.
So I think you have to have that innate ability. Now, it's probably a small percentage of people who just can't do the physical aspects of anesthesia. I'd assume the same for aesthetics. But yeah, you have to have that as well.
More schooling, CRNA or aesthetics?
Well, so CRNA for sure.
Yeah.
I mean, aesthetics really doesn't have, there
Specific,
are some governing bodies, but it doesn't, it doesn't really have, like, people can go to a weekend course, like an 8-hour course or whatever, and be certified.
Okay.
That is not what I did. That is not what anybody in my office did. Yeah. So I just want to put that out there. We've spent tens of thousands of dollars.
Because people can just say,
annually.
like, I'm certified and come get injected. And that's been,
right.
That has been happening with.
So as a consumer of her product, I would warn everybody looking to get aesthetic stuff done, check out the practice, right? So they are all very highly trained, do a really great job. Somebody who hangs up a shingle on the side of the road might not be. So you definitely want to do your research, and word of mouth is probably one of the best things that you can use. But also just checking out, I don't know what the governing bodies are or what the credentialing bodies are. Whatever,
it's so crazy. So interestingly enough, I don't know if you guys saw maybe like a month or two ago at this point, there was a story on CNN about fake Botox.
Oh, yeah.
And it was kind of like Midwest centered.
And the prices are lower, right? Like way kind of lower.
Very low, yeah.
So what was it? What was the fake Botox? Was it just nothing, or was it detrimental? Okay, that's a good question.
Well, there were some people that were hospitalized from
it had to be something.
But there are reports, I haven't personally witnessed it, of that happening in our community as well. So I did make a little reel on it. So I just want people to be aware, like, if someone has a question, like, they can come to our office. Like, you can look up my license and all of our other licenses on in Indiana's webpage, consumer nursing license, on all of our stuff. If someone's like, oh, I want to see your receipts from whatever, like, okay. If you're truly that concerned about it, like, which one? You want Evolus? You want Allergan? You want MERS? Do you want Revance?
I don't even know what those
Galderma?
are.
So.
So if somebody's out there and they're like, because what I want to kind of transition to now is like aesthetics.
Sure.
Like if somebody is like, why is it so expensive? Like because aesthetics is a pricier
when it's
a
treatment,
it's
right?
a luxury
It's cash, too.
treatment.
Yeah.
It's a luxury treatment. Mm-hmm.
So break it down for us. Like what is aesthetics in general? And if somebody's kind of on the fence of doing it, like you can even speak about your first experience doing it.
I just do what my wife tells me to do, so I didn't really have a choice, but I can speak about it if you'd like.
I just love her.
So what is what is aesthetics in pure and simple's form?
I'd have to get out Google really.
No,
but, it's
what procedures do you do? How do you make it all work together? I think is what he's asking.
Sure. So at our office, we have this big bucket of treatments that we can do. Right. So we have anything ranging from skincare only, so we can do Botox fillers, biostimulators, all sorts of laser treatments. We have resurfacing, we have pigment treatments, acne treatments. Redness, like rosacea, vascularities, cherry angiomas, laser hair removal. So, we have this big, bucket of things that we can choose from. But not every treatment is going to be for every patient, whether that's personal choice or whether that's, their diagnoses. So, if someone comes in and has melasma, we are not going to be putting an IPL or a BBL on them because it's going to make it worse.
So delve into that a little bit because we have quite a few viewers who aren't medical. So
sure.
So what's melasma? What's IPL? What's
and your host?
And what? Don't you worry, you're up next.
Specifically speaking, melasma is hormone-mediated pigmentation. It usually you can be called the mask of pregnancy, so to speak, but it has a very characteristic presentation on the face. Triggers to make that worse are going to be heat and light. So that is exactly what an IPL or a BBL are. They're going to be heat and light based. So, and they treat very superficially. So if you treat someone with that, so again, this goes back to your education base. So not everyone with a laser is going to be doing the best thing for your patient. Right. So you can get rid of that pigment very quickly, but it's going to make it worse after the fact. It's going to come back more, more pigmented. It's going to come back faster with those reigniters. So, in terms of those kinds of treatments, you have to have that medical knowledge behind you for knowing what you're doing and why. We have a vast majority, we have a vast array of patients that go from just doing skincare to all the way up to doing all, our microneedling, radiofrequency microneedling, our erbium resurfacing, laser treatments, so it can vary, and it depends on what you're looking for, what the patient's areas of concern are.
So tell me your 3 most common procedures and then your favorite procedure to do.
So I would definitely say our most common is tox, and that's pretty standard with every med spa, statistically speaking. Right. I would say after that, probably filler, at least for right now in the summer, or our PRP biofiller. Right now, just injectables are pretty high in the summer. After that, it's going to be starting in the fall, we're going to start working on more pigment. Everybody kind of cleaning up what we did over the summer. So we're going to start going into some of our radiofrequency microneedling and our laser services, like erbium and pico and all those kinds of things where we're targeting that pigment.
Nice. And then what's your favorite procedure to do?
Oh, my favorite procedure.
We ask all our guests. So.
It's going to be tox. It's going to be. I just love it. I get to talk a lot, which I have a problem with.
So what about your first experience? I want to know your first experience and what you thought of it before you walked in. So talk about your thoughts of aesthetics before and then after. You're walk us through your first.
So I'd have to ask Alicia if I actually had Botox at any point. I don't think I did. I don't think I ever had Botox before I came to you.
I don't think so.
I know a little.
At least on your history, you recited it.
Well, whatever. I always check no on all the history stuff, so it doesn't really matter. Listen to what I say, not what I do. Obviously, being in the medical field, I knew what Botox was, how it worked and stuff. But it was fine. I sat down in a chair, and she's very gentle. It doesn't really hurt. You can tell something's going on, but it's not really painful. I hear that some people are, so kudos to you, I guess, that it wasn't really painful.
Thanks.
And then it takes, what does it take, a week to fully kick in? You kind of notice some changes at first. Probably the hardest thing for me is you can't get a massage or work out or wear a hat for the first like 12 to 24 hours, right?
Yeah.
So that's the hardest thing for me.
So you can't work out.
The wearing the hat and the working out part.
You know, as with all patients, we time that appropriately so that we can, you know, work out beforehand for the day.
Yeah.
What is the percentage of men versus women getting procedures? And I'm sure that's gone up over time, right?
Let me just say it was a very good experience, and I continue to get all kinds of things done, mostly Botox. But I mean, you just zapped. I had a cold sore. You just zap that with a laser. I mean, yeah.
Ringing endorsement.
Yeah. Look at me.
We were working on your scar.
Oh yeah. We did. We zapped my scar.
Yeah.
That made it a lot better. We haven't told the story of that scar. We'll have to do that. Sorry. Go ahead.
I know.
Men versus women.
Yes, 100%. That story. What was the question?
Men versus women. So what percentage of men versus women?
Oh, I would say we probably have 5 to 10% of men in our practice.
Okay.
So it is, you know, female dominated. But I think one thing that's really interesting, and part of my backstory is that as women, and this is the point that I can speak to, I feel like we lose ourselves so much in taking care of everyone else. We have our careers, we have our our husbands, we have our kids, and a lot of times we put ourselves last. So when I saw that photo of myself, I was like, oh my gosh, like what is happening? Like not that I would do it any different, but I needed some time for myself. I needed some time to really fill my cup up so that I could better take care of everyone else. And so that really having that aspect that make me feel better. It's not necessarily about like, you know, aesthetics on the outside. For me, it's more of wanting to feel better about myself and feel like and look like who I used to and who I remember myself being. So that's like the point for me personally and where I come from and where all of my staff comes from when we're treating our patients.
Yeah, it's a good philosophy. Yeah. I mean, I'd say that's probably consistent nationally. I don't know about internationally, but at least nationally, smaller percentage of men. But I think, and you can speak to this maybe too, that the percentage of men having aesthetic procedures is growing, right? So if you look 5 years ago versus now, or 10 years ago versus now, I would say it's probably increasing, right?
I would agree because again, we're just trying to feel better, right? Like we're trying to look how we used to. We all have areas of concern. I mean, maybe it's just, you know, the spider veins on your face or around your nose, or, you know, we've had patients come in with rhinophyma, which is a subtype of rosacea. So, you know, I've had men with that concern list. So what are we, you know, how are we going to feel better about ourselves? And what does that look like? And how does the aesthetics play into that?
All right. So I got something here. I was going to do this to you, but I'll have her do it to me instead. So if you had your way all the time in the world, money wasn't a concern, what would you do to me specifically from an aesthetic point of view? I was gonna have her do it for you, but I'm gonna make her.
I want the answer now, but yeah, you guys start.
All right.
Well, so obviously you do tox, which is great. You also do skincare, which if anybody comes into my office and you have to choose between treatments and skincare, I'm going to tell you skincare all day long. Like,
fair.
I don't, if you have to choose, do your skincare, because that's going to be, so I tell people it's like, you know, brushing your teeth versus going to the dentist, right? So you go to the dentist 2 times a year, you get your cleanings, whatever. That would be like coming into the office for treatments. But if you're not going to brush your teeth and floss at home, what's the point? You know, what are you doing?
That's fair.
So I would, so this is, it's kind of a double-edged sword, because my first question is like, what are your areas of concern? You're like, whatever my wife says, right?
Correct. Right.
So you already do tox, which
maybe we should bring her in. Okay, so tox, tox.
You already do tox, right? So maybe some volume restoration, because you do have those crow's feet that extend down in here. But some men it doesn't really bother, because you know you're more distinguished, right? So you know,
look at that smile.
Wait. Just gotta avoid the crow's feet.
Yeah, your tox hasn't kicked in all the way. So,
I know.
That's fine. So yeah, I mean, we could work on some texture. You know, you do all the things that we have to be careful when we're doing resurfacing or doing laser treatments because of your beard down here. So I wouldn't, you know, treat down there necessarily.
I shaved this morning.
With some lasers. So, you know, it just kind of depends on your areas of concern. So really, I wouldn't, you know, volume restoration, because the aging process sucks.
Okay. All right. You want to do Vahid?
Yeah. I'm curious.
I didn't know if you'd be okay.
I've never had Botox before. I've never had any procedure before.
Look at that Persian skin, though. I mean, he's older than I am, and he's got beautiful Persian skin.
Genetics.
I'm a little jealous.
Yeah. Tox.
Yeah. Mm-hmm. Tox.
For sure.
Do this right here.
Your angry face. Yeah.
That's not
that
bad.
One. Mm-hmm. That one right there.
Yeah, in the middle.
Too many years of scowling. Yeah.
You're just living life. You're having
I am.
expressions.
I'm living my best life.
That's right.
I got one more question.
Yeah, go ahead.
So we can cut this if you don't want to answer this question, but
Never.
multiple times I've gone to tip and you told me no. So explain that to me.
It's a medical procedure. We do not take tips on medical procedures. So that's the thing that.
Oh, tipping.
Yeah.
I mean, that's a huge topic that we can probably talk more about. But I always you've been with me enough.
Tip. Yeah.
Wait,
You tip. You tip well.
Yeah, I like to tip, and
I do not
nope.
accept it. No way.
Yeah.
So why? Because it seems like all service based.
Right.
Industries,
By the way, I'll take tips after.
Make it rain.
Yeah, right.
Make it rain.
So I think this is the kind of the complexity where, as an industry, I don't want to say we struggle, but we have to kind of play that kind of like gray area, right? So we're not a salon and we're not a physician's office, but it is a medical office.
procedure.
It's a medical
Right.
procedure. So, people don't want to come into this like white, sterile environment, but you want your providers to be well educated and take good care of you, right? But we're also not, we're not getting our nails done. We're not getting our hair done, our lashes done, like those types of things. So it is a service, but it's a medical procedure. So like all of the things that we do are from orders.
Gotcha.
It's all ordered.
Nice. So I
That's
didn't
an
know
interesting
that.
question.
It's interesting, right? So I didn't realize that.
I mean, if you had a tip jar next to your block, your
awesome.
butterfly IQ
That'd be
3,
awesome. Yeah, sponsor our podcast.
Thank you for my
it'd be a little bizarre.
I don't know. I'd
Right?
walk around with a jar. Hey, was that block good?
We'll work for money.
A few bucks. Yep.
You know how like the meme is like you just turn around the iPad and like there's. I just need you to answer a few questions.
How was your treatment?
Yeah,
what do you
exactly.
want to tip? Yeah. I mean, I think tipping's a huge. Maybe we should do a whole podcast on tipping.
I think we
tipping's
should.
a huge issue right now. And anyway,
Good or bad? Yeah.
So what somebody tells me if they're wanting to tip, I said if you're wanting to spend more money, buy a skincare item.
Oh, okay, fair enough.
Got
Do
it.
something that's going to be better for you.
Next time.
No, it's just Alicia will just get more.
But you steal hers, right?
Yeah. I mean,
I feel like we should get Alicia on to talk about this.
I have
because
the eye cream. I have the face stuff I use at night. I have like the
SPF.
SPF. The SPF I use.
I think he's pretty good at doing all this stuff too.
I
Very
I do
disciplined.
think he's a very compliant patient.
Yes, I am. Yes.
Good job.
Except I check no on all the boxes of every time I go
I think the
anywhere.
reason that you do that is just because you don't want to take the time to read it.
Correct. Expediency. Correct. Yes.
So
You were going to ask something else though when I interrupted.
No,
you about tipping,
not at all. We usually ask our guests. They've all sort of been medically related, but
Okay.
we'll ask you the same question.
Okay.
Where do you see the future of medicine going in the next 10 to 15 years? And I'll kind of take it further than that with you.
Okay.
Where do you see the future of aesthetics going
And anesthesia. So medicine, anesthesia, aesthetics.
in the next 10 to 15 years?
I think I'm better answering the aesthetics question than anesthesia.
That's
So
fine.
I'll start with
No,
that.
Yeah.
Regenerative medicine. That's
So
what I
PRP
really think.
and that sort of
PRP, PRF services, loosely stem cells. Obviously that takes a lot of governmental oversight and those types of things. And there's lots of discussions about those specifically, but I think regenerative medicine and more so the discussion about longevity, where we're not necessarily just treating the exterior body, but in the inside as well.
So delve into that a little. We're going to break this into 2 podcasts.
Yeah,
Okay.
dive into
delve
that.
the regenerative medicine thing because I'm completely ignorant to that whole area, but I hear it a lot. It's like a big buzzword, and I've even. Honestly, I've even said it and been like, yeah, regenerative medicine. I don't know what that means. So you dive into that.
So we have growth factors in our bodies, right? So some of our services we do like with PRP, platelet-rich plasma, or PRF, platelet-rich fibrin, which, are similar products, but they really are capitalizing on the growth factors that we have in those self-derived products, right? So the thing about that is though sometimes depending on our patient's health, the growth factors or PRP are either better or worse quality. There's lifestyle, like do you smoke? Are you a heavy drinker? Or Do you use recreational drugs? What is your age? What is your normal health status? Do you have longstanding, diagnoses that are going to be wearing on your body? So there's a lot of variability with I don't know how you want to say this, but how good it's going to work, right? Yeah. So from that has kind of transitioned to exosomes, or like in our office we use plant-based nanopeptides, which are going to be cell signalers, right? So they're going to kind of be, I don't want to say like a derivative, but an alternative to PRP, PRF, where they're going to be signaling your body to do something, right? So we have transitioned to using some of those types of products because you get a more consistent, predictable result.
Is it as good? So, like, let's say you've got, just the healthiest person in the world, and you're doing PRP or PRF with them versus doing the plant peptides.
That's a tough question. I mean, obviously, if you have someone who's older and their PRP is going to be less effective, then of course the plant nanopeptides or the exosomes, I personally feel like they're going to be more effective. But it's pretty
even regardless, it's pretty close, right?
Right, okay. And so that's why, in our practice, we could do all the things, right? Like it's very patient dependent. So if you go anywhere, aesthetic medicine, they're like, well, this is what I do every single time, regardless. Like there are some recipes that work really well, and that we do because we have consistent, repeatable results from that. But in those types of situations, it really depends on the patient, right? Like who do you have in front of you? Same with anesthesia. Like what are we doing? What is the goal? What does the patient, look like? What is their
you start with a basic recipe, but then Correct. You have to modify it based on patient factors.
So let me just break it down simplified for that non-medical folks. So you take their blood, their cells, you mix it with rejuvenation, whatever.
No, we just spin it. We spin it in a centrifuge. Yeah.
So you just spin my own blood.
Yeah. Correct.
And what are you doing while you spin it? Like, what is the
separating out the components?
I'm playing The Time Is Right theme song. Just waiting. But no, we let the centrifuge do the work, right? So heavier blood products are going to go to the bottom. Okay. So your red blood cells, white blood cells, those types of things. And then your lighter products are going to go to the top. So it's going to be your platelets, growth factors, those kinds of things.
And then you re-inject it.
Yep. So depending on what we're doing, you can heat it and cool it. So we have our Selenosterma, which is a PRP biofiller, but you take some of the PRP through this heating and cooling process where it's creating a gel. So it's creating an albumin gel out of it. So it can volume restore at the same time where it's stimulating collagen and elastin production. Or you can just re-inject the PRP itself and capitalize on those growth factors.
And is this specifically for rejuvenation of the skin or body? Or is this like energy rejuvenation? Like, is this like almost like a drip where you're like kind of rejuvenating?
So it's going to be the first. It's going to be restoration of volume, collagen, elastin. We can do
make it look pretty.
We can do hair as well.
Oh, hair. Nice.
Yeah. So PRP, hair restoration.
I don't think either one of us have a problem with hair, but
I don't think so.
Thankfully,
it's too gray. But aside from that,
I have to ask you about drip.
Okay.
What are your thoughts on drip places have kind of
like IV
IV drip,
right. So we do have those in our office. We're kind of transitioning out of them at this time because if we're going to do anything in our office, we're going to do them really, really well, right? We're going to practice at the highest level that's available, and not saying that we don't do those well. It's just not a very highly sought after procedure right now for us, and I think there are other places that do them well that we can refer patients out to.
Got it.
So, I mean, I do think there's some validity to that. Again, like what is your bioavailability going to be? What are you looking for? Like, are you going to do this and maintaining, and then you're going to go out and just, eat McDonald's every day? Like they're not going to balance out, right? So I think everything has to be thought of as like this big picture. What does the big picture look like?
So for your big picture, we went back to that question of the future of medicine.
Yeah. What's the future of aesthetics?
Well,
you already did that.
She answered that. Right. But I do want to ask you, now that you've got kind of this growing business.
She's not going to answer this question.
No, you don't have to answer the question.
I'll answer it.
Your thoughts on where do you go 10 to 15 years? Like, is your focus going to be more on that than it is on being a CRNA? Like, what is...
Well, I do love anesthesia. Yeah. I'm really happy where I work right now. I work, mostly in an ortho hospital. So it is very... like procedural based in what my care is. So I do a lot of blocks, spinals, those types of things. And I do like that aspect of it. I think I have to maintain some hours for licensure. So I think I'm almost at that base.
I don't know what the number is, but
I'd have to double check. I haven't looked because it hasn't been like a relevant topic yet. But so I do love doing anesthesia. But the mornings are very early.
It's because we work with orthopedists who like to start at 6 a.m.
But
Dr. Cian, talking to you, Dr. Cian.
it's early. Mm-hmm.
Yeah.
But I do love doing that still. I do love doing the aesthetics, and I love running the business aspect of it. And I love my team; they are just phenomenal. And we don't just work really well together. Like, we are friends outside of that. So we're all like have our individual personalities, and I think we mesh really well together. So I'm very happy where I'm at right now, doing both aspects of it. And it gives me more flexibility with my family.
Well, thank you for sharing your story, like how you got there, because I think it's a really interesting journey.
Definitely.
I mean, you didn't start in medicine, which is, I think like for the average Joe or whatever, it's like, oh, if I don't start in medicine, well, I can never practice medicine.
Yeah.
I think that's it resonates for people who are outside of that, that's community.
Yeah.
Mm-hmm.
Like if I don't start there when I'm 18, there's no way that I can ever go back. Yeah. So I think for you to share your story is super important on the steps you can take, and you can do other things too. That keep in that medicine realm.
I think this goes back to just her story, and everybody we have on has multiple areas that they participate in and multiple streams of income. Like I think in the United States right now, if you're just going to work and getting a paycheck, I think you're missing out on all the benefits of having multiple streams of income. So, I mean, everybody has you do the aesthetics and CRNA and all that other kind of stuff. Ryan, your husband, does pain and anesthesia. Dr. Cian owns his own business.
Correct.
Right? So I think everybody we have on takes a different route, but everybody has more than just the job they get a paycheck for. So, and as do you, obviously.
Which is very different than 40 years ago.
Oh,
though.
yeah. Definitely.
I mean, for sure.
Or 20 years ago, even.
20 years ago. I mean, like, we're all business owners here. And you both practice medicine. I mean, this happening 20 to 40 years ago just it just wasn't commonplace as it is today.
Well, and just to kind of add to that, I will say, like, I did not make any money off of this for a number of years. Yeah. Personally. So everything was reinvested because I was really into like growing our business and, doing well for the community. And giving them what patients were asking for. So, I take a little bit of income off of this, but I, could make much more doing
straight up anesthesia.
Yeah.
But again, it doesn't, like, what purpose does it serve? It wouldn't serve my family.
So one more thing, and then it sounds like you're getting ready to close, but would you do it over again? And second part of that question, what would you have done differently?
Yes, I would do it over again. What would I do differently? Oh, goodness. Maybe start earlier. Like
with the aesthetics end of things?
Yeah. Get my own treatments done earlier so I didn't have to do as much work getting backpedaling.
Well, it's good to hear that, every guest we've had on would do it over again.
Yeah.
That means you're still invested into the medical community.
I don't think
even though we've kind of not exposed. That's a big term, but
I think it's true. I think that the general population does not understand all of the downsides and craziness in medicine, right? So hopefully we are exposing some of that while also keeping people abreast of the fact that we care about patients and we do a good job and all that kind of stuff too. So.
Yeah, I mean, probably owning and running a business is way more than what I thought it was going to be.
Right. That's true.
But I would 100% do it again. But, when people are like, oh, I can work whenever I want. I'm like, yeah, you're going to be working 24/7.
Yeah,
like,
exactly.
that's all. It's always.
Yep.
My
That's
husband's
how it
always
is.
like, can you stop? And I'm like, ugh.
Not right now.
Yeah. So.
Well, thank you so much for sharing your story. Thank you for being on the podcast. Absolutely. And I want people to know where to go to find Pure Aesthetics. And also, you've got a new podcast?
Sure. Yeah, we did. We just recorded our first 2 episodes. I'm really excited. It's just going to be more of like a get to know you and education series. So whether you're with us or not, I find that a lot of people come into our practice and if they've had aesthetic treatments before or if they haven't, like a lot of our our procedures or our, what we're doing is going to be education based. Like we're going to be teaching you about your care, right? So we find a lot of people just have no idea what they're getting done or what procedures or why. So it's just going to be more based on that, so that people can be educated about their care. Like I said, whether they're with us or not, it has nothing to do with that. It's just to give back, really.
So where do they find you? I think this is what Vahid was getting at. Where do they find you? Like, let's say, where do they find Pure Aesthetics online? And, you can throw out the address too, right?
Yeah. So you can find us on Instagram, Pure Aesthetics and Wellness. So there's no E after Pure, it's Pur. On the internet at www.pureaesthetics.andwellness.com. Again, no E. And then we are located in Granger, Indiana, on Heritage Square at 7225 Heritage Square Drive, Suite 240.
And the podcast is called The Pure Truth.
The Pure Truth.
With an E or without an E?
Without an E.
Yes. That is branding. That is branding.
Yeah, The Pure Truth. So we're just, like I said, it's gonna be a lot of fun. I had a lot more fun than what I thought I was gonna have. I was super nervous, so it's gonna be fun.
Awesome.
Everyone should tune in.
Thank you to you both.
Yeah, thank you.
Thanks for having me.
Megan, thank you so much. This is Going Under Anesthesia Answered with Dr. Brian Schmutzler, and we'll see you in the next podcast.